So what can I do for you today, Jack? Is it just a routine review today?
It is indeed, yes.
Plenty of inhalers?
Running low at the moment.
Okay. So I've not seen you for a little while, so I'm going to just go through a few bits and pieces with you, if that's okay.
Mm-hmm.
So you're coming for your asthma review. What I'm always interested in is, has anybody ever explained to you what asthma is and how your medication's working?
They may have, but I've kind of forgotten it by now.
Okay, so should we just go through that quickly first of all? It's a good place to start. So asthma affects your lungs. Your lungs are quite big. They go from sort of the tip of your collarbone down to the bottom of your ribs. Big bags full of air, okay? Asthma clearly affects the lungs. Doesn't affect the tissue of the lungs, it affects the tubes that run through, okay? So I'm going to draw it for you. So if you imagine the tubes of the lungs, they're round, they're not that big, clearly, and they're lined with a mucous membrane. So that's the same as up inside your nose. It goes from your nose all the way through. And in somebody that doesn't have asthma, or somebody whose asthma is well controlled, it sits nice and close to the edge, like this, leaving a big hole in the middle so the air can whoosh in and out quite easily. Now we know a couple of things about asthma. We know that it's variable, so it doesn't vary day to day, but week to week, month to month, you will see some change in your asthma, it's quite likely. And we know that it's inflammatory. And the bit that gets inflamed is that mucous membrane, that lining, okay? If you inflame a mucous membrane, it swells up. And if you imagine it's in a tube, it's got nowhere to go. So what it does is it swells into the tube. So you end up with something that looks a bit more like that, which means you've got less space to breathe, so it makes it more difficult to breathe. The second thing that happens is around the outside, you've got a muscle, and it's a muscle that you can control a bit. You can hold your breath, you can make yourself cough, but on the whole, it's under the control of your nervous system, of your brain. So if, for example, you hold your breath for too long, your brain overrides that and makes you breathe, and if something goes down the wrong way, you cough. And we know that when this lining in the inside is inflamed, this muscle here gets quite twitchy. And when it comes into contact with something that triggers it, and the triggers are different for different people, so it might be a cat, it might be a smell, it might be exercise, going from warm to cold, those sort of things. That muscle then, when it's twitchy, tends to go into spasm and shuts down on the airway even more. So that's the time when you're going to feel tight-chested, short of breath, you're going to cough a little bit, those types of things. Does that sound like some of the things you've gone through?
Yeah, definitely.
So it's useful to know what your inhalers are doing. So your brown inhaler works on this inflammation in the middle. When you take a brown inhaler, you don't take it and suddenly think, that's good, it's sorted it. It doesn't work like that. What it does is it settles the inflammation down, shrinks it back to a normal looking airway, and then you need to keep taking the medication to keep it in that healthy state. So that's where your brown one works here. Your blue one works on that twitchy outside. So if you get symptoms, if you cough, if you wheeze, you take your blue inhaler, you know that within about 5 minutes things feel better. What it does is it relaxes the spasm in the airways and just opens them back up again within 5 or 10 minutes, lasts for about 4 hours. Okay? So is that something that you've thought through, or is that something that's quite different to you? Does it give you more of an idea of why you need to take your brown inhaler?
It does, definitely, yes.
Okay. So how often are you taking your inhalers? You've got a brown and you've got a blue. There's no right or wrong answer. How often do you take your brown inhaler?
So I take my brown one twice a day, and the blue one sort of as and when I need it.
Okay, so the brown one, is it 1 puff twice a day or 2?
1 puff twice a day.
Okay, and are you really good at doing that? Because I know that if I had to do something twice a day every day, I would not be particularly good, and I know I'd forget. And it's quite normal to do that. So in a normal week, do you take all of those puffs, or do you miss a few?
Normally forget about 2 or 3 a week.
Okay, and are they at any particular time of the day? Are they the morning ones, the evening ones, or is there no pattern?
Sometimes the evening ones, but there's not really a particular pattern.
Okay, so what I'd suggest with that one, so often if you associate that with something else you do twice a day, it means that you're going to remember to take the inhaler. And generally when you've taken a brown inhaler, we like you to brush your teeth, rinse your mouth around with some water, gargle and spit. So if you do it before you brush your teeth, that's a good prompt. So if you get to the toothbrush and you haven't done it, go back and do it, okay? So the blue one, just a couple of times a week. Is there anything in particular that makes it, is it exercise? Is it during the night? Is it during the day?
Mostly stuff like exercise and things like that that sort of trigger me to use it.
Okay, and is that because you feel tight-chested, or is it just in case?
A bit of both usually.
Okay, so I think if you increase that number of brown inhalers that you're taking and you do it twice a day, you shouldn't need to do that, because things will be a whole lot more stable. Okay, good. So your inhalers, so currently you've got something that looks a bit like this, but you've got a brown and a blue. Okay, have you got one of these?
I don't know.
Okay, do you know if you've ever been given one and you've lost it, or you've never had one?
I don't think I've ever had one.
Okay, so we'll not look at that one. So can you show me what you do? This hasn't got any medication in it, it will fire, but it hasn't got any medication. Can you show me exactly what you do with it?
Of course. give it a shake, take it off.
Okay,
There you go.
so that was a bit fast. So when you squirt this, it comes out really quickly if you look against there. So what you have to do with this one, because it's already an aerosol, is you need to breathe much more slowly to slow it down. However, I think probably this isn't the best inhaler for you. I think we could probably do better. So the other thing is with these, can you tell when they're empty?
Not really, no, it's quite hard to tell until you get down to the bottom.
It's a bit of guesswork and then you run out. Okay, so the other thing is a lot of the new inhalers have got dose counters on.
Okay.
So that might make it an awful lot more easy for you. So I think one of the things we're focused on at the moment is the effect we're having on the environment, and I think that's in our general life and certainly in healthcare we're thinking about it. And these types of inhalers contain propellants, gases, like you see in hairsprays, deodorants, that we know can cause damage to the environment. Now, if that's the inhaler you need, then that's absolutely appropriate. But if we can move you across to one that doesn't have those propellants in, it's going to be better for the environment, and we can still give you the same medication, control your asthma in the same way. It's just using a different device, and actually probably one that's much more appropriate for the way that you're breathing. Is that something you're interested in?
Definitely, yes.
Okay, so there are quite a few of these. They're called dry powders. So this one's called a metered dose inhaler, and these are called dry powders. Okay. So the difference with these is they don't fire. So what you have to do with these is you have to breathe in hard and fast, so your breath creates the aerosol to drag the medication into your lungs. Okay. So there are quite a few choices. What I'd probably suggest for you is this one, simply because you can swap your brown and your blue across to this one. It contains exactly the same medication. It doesn't contain a propellant. It's got a nice dose counter on, so that if you know exactly where you're at with it, and they're really easy to use and they're nice and small.
Okay. Yeah.
So shall I just show you what you do with these?
Yes, please.
So what you do, you give it a shake first of all. You then pop the cap off, click it, and then the technique is the technique you were actually using for this one. So you're going to breathe out completely so your lungs are empty. Seal your lips around the mouthpiece. Breathe in hard and fast and deep. Hold for about 10, and then gently breathe out. And if you're prescribed 2 puffs, you have to repeat the whole process again.
Okay.
So if I give you that one, can you have a little practice of that and see if you can do it?
Of course.
How did that feel?
Much easier.
Yeah, because I think it's the right technique for the way you're doing it. The thing to remember is you can click this one anywhere. So you don't, whereas with this one you have to do it when it's in your mouth. With this one you can click it and then put it in your mouth. Although what I don't want you to do is to start to breathe and then click it, because it doesn't work as well. Okay, so it is a click and a breathe. Okay, so as I say, we can swap your brown and your blue. So you get the same medication, no propellants, nice dose counter on the side. The other thing with these is they come with a QR code.
Okay.
So if you get home and you forget what I've told you, which a lot of people will do, if you use your phone to just zap the QR code, it will take you to a video that shows you exactly how to use this. So if you're suddenly thinking, am I doing this right? Just check the video. Good idea to get somebody else to watch it with you, and then you demonstrate how you're doing it, because somebody else can be a little bit more objective as to whether you're doing it properly or not.
Yeah.
Okay. The only final point to think about is to think about what we do with these when they're empty. What most people do is put them in the household recycling, because there's really not much else you can do. But actually there are other things you can do now, and what I'd really prefer you to do is when you go to the pharmacy to pick up your new inhalers, drop your old ones off.
Okay.
Because they've got not a recycling scheme at the moment, but they've got a safe disposal scheme, so that these don't end up in landfill, don't end up polluting waterways and the likes. Okay. I think I've gone through everything I wanted to talk about. Have you got any questions?
I don't know.
Okay, so I'll change your inhaler today. I'll send it off to the pharmacy and you can pick it up from the pharmacy. The pharmacist may well show you how to use it again.
Okay.
Any problems, pop yourself back. Any questions, you can just give me a ring.
Wonderful. Thank you very much.
That's good.
Cheers.
Take care.